Hi, I'm Dr.Suvarchala, Scientific Director with ZIVA Fertility Centers. How will doctors decide if the couple, the male or the female partner, have issues which are causing infertility in the couple? So to understand that, first you have to understand, as soon as you approach a fertility center or a fertility consultant, a gynecologist, they begin by taking your history, and by history I mean medical history, sexual history, surgical history, and within that medical history, if you have any previous conditions such as diabetes, thyroid, your prolactin is high, so on and so forth. Surgical history, if you had previous surgeries which are directly connected to the problem that you're facing. So if you've had, for instance, any laparoscopy for endometriosis, or you've had previous ectopic pregnancy where the pregnancy was inside the tube and the tube had to be removed, is that the reason why you're not getting pregnant? All these are looked at very carefully so that we can see what is contributing to this factor of infertility. Next is sexual history. Sexual history is a very important thing to discuss with your fertility specialist. If you're not able to consummate your marriage, if you're not able to have proper intercourse, if you are facing problems in terms of ejaculatory disturbances or erectile disturbances or libido, low libido, any of these things have to be definitely discussed with the doctor, or any psychological issues have to be brought out in the open so that your doctor can then give you the right advice. When all this is done, the first line of investigations definitely are divided into male and female. Within the female, we do a panel of hormonal investigations to see if the ovarian reserve is good, if you're menstruating properly, if you are at the right age of the fertility potential. All these things are calculated through these hormonal investigations. An ultrasonography is also performed to see how your ovaries and uterus are behaving. If you have any congenital problems, all these things are looked at very carefully. And in addition to all this, your partner is tested for semen and sperm parameters. So according to WHO guidelines, we have been given some baselines, some guidelines to assess each sample that comes to us. So according to those parameters, we are then very closely looking at the count, motility and morphology. All these things are accumulated and then come to a conclusion where the problem lies, and then the treatment begins. So then how does treatment begin? Even before beginning the treatment, after all the history is taken, a few factors are taken into account. First, the duration of infertility. How long have they been infertile for? Have they really tried for a year and they're under 30, or they are above 30 to 35 and they've not even tried for 6 months? So those are the very important factors that are looked at. The second one is the age. The age of the female partner plays a very critical role in deciding what treatment to offer to this couple who has approached them. Next is factors contributing to infertility. From all the history that is taken, the factors which are contributing to this infertility are picked out. Some are very evident, some are unexplained. So it's not that after a history taking and investigations also a fertility specialist is able to pinpoint where the problem is. Sometimes it is unrelated and unexplained, but most of the times something pops up from hormones or scans or semen analysis that clearly indicates where the problem of infertility is coming from. So that's a very important factor as well. Then the couple's treatment preferences. Now after all the counseling is given, after the treatment options are explained to the patients in terms of success rate, cost, duration, how long a procedure will take, and the options that are available to them. Now everybody may not be eligible for IUI, everybody may not be eligible for ovulation induction with timed intercourse, maybe because of age, maybe because of blockages in tubes, maybe because of severe stage of endometriosis. There are so many causes that stop a clinician from offering all treatment facilities to all patients. So when all these are given, a couple is free to choose their treatment options. Some are clearly unинdicated. The doctor will specifically tell you that it will not work for you and it's an entire waste of time and your money and energy and the hope that you are also investing. Some are totally not potential, but some are totally left to you to decide whether an IUI, intrauterine insemination, is something you want to go for, or an IVF, which has a higher success rate, is something that you want to look at. So these are options which are put forth in front of the patient. and some are decided by the doctor also, keeping in mind the duration of infertility, the age of the patient, the factors that are leading to infertility, which are clearly indicative from all the investigations and history. And the fourth and the most important thing is the couple's choice of treatment. So these are the factors that are very critical in deciding the treatment options. If you would like to understand what your treatment options are based on your factors, please feel free to come down and consult us. Thank you.